Uganda Water and Sanitation Network has continued with her mandate and commitment to improve the status of water, sanitation and hygiene in Koboko district, especially in Dranya sub-county, where the project promoting good governance and accountability in water, sanitation and hygiene WASH, and integrated water resource management delivery in Uganda, funded by the Austrian Development Corporation, is implemented.
I'm here today in Koboko with Iwrm to see the progress on their project. We collaborate with Iwrm since 1 year, and we do so because we want to enhance the capacities of the communities to have a say in how the quality of the public services regarding to water and sanitation is being done in the vicinity. We do not only want to work with actors in Kampala, which we do. Iwrm is one of the key and trusted partners of the Ministry of Water and Environment to present the annual mirror reports of how the status of water is. But we wanted to say, let us go directly to the communities. We wanted to see how is Koboko district doing, how are the sub-counties and the parishes doing, what are the populations saying, what are the people saying, the LC1, the healthcare managers, what are they saying about the status of WASH in their direct environments. What Iwrm has done with our project is to introduce a scorecard methodology. That scorecard methodology is not unique for our projects. It is done also with other partners in different districts so that we have a countrywide methodology of how citizens evaluate the performance and accessibility of water, safe access to water, and safe access to sanitation in their districts.
Iwrm, the executive director of Uganda Water and Sanitation Network, has continued to encourage and emphasize leaders from national to lower level to prioritize the budget allocation for WASH activities.
This program is implemented in 5 districts in West Nile region, but today we've sampled only one district, Koboko, and one sub-county, Paria, to come and see what have been the outcomes of the governance program that we've implemented within a year. The main structure of this program, the foundation, is the WASH scorecard, which is implemented at both community, at schools and healthcare facilities. We have a total of 5 districts, 8 sub-counties, and in each of the sub-counties, we try to make sure that we sample our community, water source, a healthcare facility to assess its performance regards ensuring that there's adequate clean water and it's also clean, and also schools to see how they're prioritizing mainstreaming of water and sanitation. Where we are now, after we conducted the scorecard around half a year ago, we are happy to note that all the points that we visited within Koboko district, right from the district local government, we are appreciating that they appreciated the scorecard and also came up with commitments that they want to fulfill in ensuring that they prioritize water and sanitation within that district. And also at the point source, at the healthcare facility that we visited, we are happy to know that already there's change upon the sensitization that was made with the leadership of the healthcare facility, and now we are here at the school, we were at the community, the leaders, to see how they're prioritizing within their means to make sure that water and sanitation is prioritized. So this monitoring visit has been successful because we've seen some positive outcomes of mindset change. But also for us, what we're calling for is that this is just a sample to generate evidence as we advocate for the wider Ugandan community.
The civil society organization has appreciated WASNet for giving them the platform to understand the gaps and priorities that require serious intervention.
All this long way back from the health center up to when we went to the water source, and now we are here, what I've been getting is impressive. It makes me feel the word we brought here has not fallen in deaf ear, because in each of these points, at least something is being recorded, something is being retrieved, something is being brought out. It's a two-way benefit. Lessons for us also to learn as well. All through ever since WASNet came, one thing we knew, one thing we saw will be a strength was bringing us all CSOs together. That will make use of resources well streamlined.
Thank you to WASNET for giving us the platform, for bringing us together, and indeed it has helped to coordinate us.
And appreciate WASNET for this great project, which is more of software. It has contributed a lot in the sense that there was a lot of duplication of self-delivery, and of course by different partners. And through this project, we're able to, as a CSOs, try to understand the priorities and also gaps that required solutions.
The community members give a comparison of how the project has improved their WASH activities in the communities after administering the WASH scorecard.
I want to acknowledge the WASNET. I think when they came in, we looked at them like as a mirror. We look at them as like a mirror, like you see how good they are. Maybe we have other bad things, we have other good things, and so on. So the bad things, as facility, we tried here. We sat down in UMIC and even the staff. We tried to bridge up some of the gaps, especially in the WAS area. We are glad to say that our WAS services that we do inside, they have greatly improved. And this time, the waste management has been, let me say, perfect. From the point of generation, segregation, and that's where we dispose the waste. And we're glad to have that.
Issues of water are really very, very important and are very critical. And that is what affects our society so most. Especially our women, they're the most hit, especially at this season, dry season. Much of their time, they spend it looking for water. As men struggle to look for other basic needs, the women, for our region, West Nile, and even in Koboko here, in most cases, concentrate on the issue of water. And I'm really very, very happy and very grateful to the agency to make sure that such an intervention is given.
We appreciate you. We know this is a software component that we have been implementing. It is not a hardware component, but I know all hopeful through your support. If one day God can also help us to have at least the hard component, so that the other capital development that we are, as a local government, we are not able to, with their aid, so that we can also come and support. So briefly, that's what I want to say. But there's a lot of improvement that we did after the scorecards.
With so far 1 year down the road, the progress of the WASH scorecard is evidently seen in the health facility, the school and community water point where the sampling is being implemented. Emmanuel Agele, West Nile TV Nilecast.